welcome to my presentation on prenatal care. My name is A.B. Wilson. I would like to discuss with you the importance of prenatal care and what the expectant parents can do to help reduce the risk of birth defects and abnormalities. It is important the expectant parents refrain from smoking at all times. Smoking or inhaling secondhand smoke can cause the baby to have low birth weight and other health problems. This is an unhealthy habit for mom and dad and can cause health problems for baby and other family members that reside in the house. Dr. McCombs advises expectant parents to refrain from drugs and alcohol. Using them can be harmful to not only the mom, but it can cause the baby to have mental retardation. Harsh chemicals, fumes, radiation, and excessive heat can also cause birth abnormalities and should be avoided during pregnancy. Dr. McCombs also reports how important it is to discuss all over-the-counter and prescription medications with the obstetrician. Medications have a numerical value on how safe they are to use during pregnancy. For example, if the expectant mom has a cold, her doctor would recommend Sudafed, and for allergies, her doctor would recommend Claritin. An expectant mom's body is working very hard to support her body as well as the development of the baby. Dr. McCombs advises pregnant women to get plenty of rest, eat healthy, and take their prenatal vitamins. Eating healthy will provide a proper nutrition and a healthy lifestyle for mom and baby. The folic acid in the prenatal vitamin is also known to reduce the risk of birth defects. Marcia Dimes reports pregnant women should not change or clean their cat's kitty litter boxes. This can cause the mom to have toxoplasmosis, which can cause miscarriage, stillbirth, or even mental retardation. It is not worth the risk for a pregnant mom to risk the baby's life for a pet. Pets are a part of the family, so she should ask a friend or relative to help with the cat until the baby is born. Ultrasounds are an amazing tool for obstetricians. They can tell a doctor so much information, and the parents have the option of meeting their little one before they're even born. Marcia Dimes reports ultrasounds can now rule out over 90% of birth abnormalities. They also can tell doctors the gestational age of the baby, how many fetuses the mom is going to have. It records the heartbeat and can tell if the pregnancy is ectopic. A personal experience for me was watching my baby change each month I went to the doctor. The first ultrasound all my husband and I could see was a small heartbeat. The next month she looked like a little bean. And the third month, we could see her head, nose, torso, arms, legs, and feet. We could tell it was a baby. Then she just got bigger every month. With the 4D ultrasound, we could tell she had my husband's nose. It was so amazing to see what she looked like before she was even born. Dr. McComb tells us how important prenatal blood work can be. During the first and second trimesters, blood work will be drawn to determine if a mom is anemic, has gestational diabetes, and are immunized against rubella and rubeola. They also routinely test for mother's blood type, hepatitis B, and HIV. If the pregnancy is considered to be high risk, then more labs may be drawn and at the obstetrician's request. During the second trimester, the obstetrician will have an AFP or alpha-fetoprotein drawn with the parent's consent. This test will check to see if the baby has Down syndrome, spinal bifida, or trisomy 18. With this test, the mother has to answer several questions, and if any of them are not exactly right, the alpha-fetoprotein can have a false positive result. If a false positive result comes back, the obstetrician will perform an amniocentesis and send some amniotic fluid to a specialized lab and have a chromosome analysis done to confirm the positive test result. This is my visual aid. This first picture is of a baby with a cleft palate done by ultrasound, so the parents are aware of the abnormality before the baby's born. Here's the upper lip, here's where the cleft palate is, and here's the lower lip, and here's part of the baby's nose here. This picture represents a baby through ultrasound, and these colored specks here show the different blood flow through the baby's umbilical cord and arteries. The bottom picture here is a person having their lab work drawn, and this just represents how important prenatal lab work is. And the big picture here on the side with the mom's pregnant belly hanging out is represents a healthy pregnancy. In conclusion, following these guidelines will help the expectant parents to have a healthy pregnancy and a healthy baby. These will help lower the risk of birth defects and complications during the pregnancy. If severe birth defects are discovered in the early stages of pregnancy, this gives the expectant parents the option to abort the pregnancy or will give them time to adjust to the special needs the child will have. The expectant parents maintaining a healthy lifestyle, physician's care, ultrasounds, and prenatal lab work are essential to giving the baby and the parents the best life possible. Questions? Is prenatal ultrasound safe? Yes, prenatal ultrasounds are not harmful to the mother or baby. The ultrasound machine uses sound waves to create the image and does not use radiation like the X-ray machines do. Can problems diagnosed by ultrasound be treated? Great question. Yes, ultrasounds are used to alter the mother's prenatal care, if necessary, to improve the chances of the mother's delivering a healthy baby. Medications and sometimes surgery can also help life-threatening or life-altering problems the baby may have. Who has prenatal tests? All pregnant women who receive prenatal care will have prenatal testing done. However, women over the age of 35, adolescents, women who have medical conditions or high-risk pregnancy will likely undergo non-routine testing. I hope you found this information to be helpful. I appreciate your time today and hope you have a great rest of the day. Thank you.